Hi everyone, and welcome on how to perform a cricothyrotomy using a 3D printed larynx. I'm Daniel Migliaccio. I'm one of the attending physicians at UNC Chapel Hill. This is Jennifer Stone. She's our MS4 that's in charge of this project. And she just matched into emergency medicine, so go Jen. She will be demonstrating on how to set up your cricothyrotomy. So all you need is the 3D printed larynx, Coban, gauze, a syringe, a scalpel, forceps, scissors. These are additional. If you didn't have these, that's okay. A bougie and an ET tube. So the setup involves Coban is going to function as your cricothyroid membrane. So you wrap the Coban around the 3D printed model, and to make sure you cover the cricothyroid membrane as well as the thyrohyoid membrane. Okay, and now you cut. To use gauze as your subcutaneous tissue. So I like to use one layer of gauze to simulate the subcutaneous tissue. If you wanted to, you could add more layers to simulate a larger patient. And then after you have your subcutaneous tissue, you're going to wrap the Coban around as a final layer of skin. And now you're ready to perform your cricothyrotomy. She's going to demonstrate how to apply this 3D printed larynx to a simulated patient. So first, she's going to place the larynx in the anatomically correct zone of where he would have his cricothyroid membrane. And she's going to grab the Coban and wrap it around, trying not to wrap too tightly to choke the patient. And that's perfect. Either one or two wraps are enough to keep that in place. So you want to position yourself on the left-hand side of the patient if you are right-handed. First thing is finding the actual landmarks. So starting from the sternum, palpating upwards, feeling the first membrane will be your cricothyroid membrane. As you keep traveling superiorly, you will feel the thyrohyoid membrane. That's not the membrane you want to enter. Remember, it's the first membrane if you're feeling from the bottom up, cricothyroid membrane right there. Once you localize your membrane, you'll want to stabilize the larynx with your left hand, your non-dominant hand. With your dominant hand, you'll want to make a vertical incision through the skin. Remember to be generous with your vertical incision. This is a life-saving procedure, which will require last-ditch effort. So you could be as generous as 2 or 3 inches if you need to. Once you make an incision through the skin, remember this is going to be a tactile procedure because you will not be visualizing the cricothyroid membrane most likely because it's your visual field is going to fill with blood. Once you insert your finger, you feel for the cricothyroid membrane. Once you feel for the membrane, you will want to make a horizontal incision through that membrane and extend your incision laterally through that membrane. Once you make that incision, insert your finger into the cricothyroid membrane, not to lose that position. Once your finger is in that cricothyroid membrane, you will insert the ET tube over your finger, feeling it insert into the trachea, and then you will slide your ET tube directly over. Remove your bougie, inflate the cuff, and voila, your patient is saved. And there's your cricothyrotomy.